Hi, everybody. I'm Sammy Hammond, an SOS trained speech and language therapist and an SACLC lactation consultant. So, today I'm going to just be giving a brief overview about feeding therapy. It's quite a vast topic, but I'm hoping today that I can give you some takeaway tidbits that will be helpful in your journey. So, sometimes figuring out the difference between a picky and a problem feeder can be difficult. Determining whether or not your child is even a picky eater to begin with isn't necessarily simple. It could just be a hiccup in their developing tastes or a phase that they're going through. If your child is a picky or problem eater, they will probably require support to let them learn to eat a more varied diet. So, just a little bit about my journey as a feeding therapist. It started many, many years ago with my little sister, who was quite a picky eater. So I decided to take it upon myself to implement some feeding therapy. What I did was I went to the fridge, got a whole bunch of foods out, blindfolded my sister, and gave her some taste tests, one of which was peanut butter, which she's actually allergic to. Needless to say, I think I ruined all trust that my sister had in food and the chances of her ever trying a new food again. However, as a disclaimer, my sister now eats everything, so I did not ruin her for life. So, what is feeding therapy? Feeding therapy helps children to learn to eat or how to eat better. It can be referred to as food school or a foodie session. Sometimes some kids like to call me their food teacher. And there's a variety of therapeutic techniques that can be used in feeding therapy, which is dependent on the practitioner. So, occupational therapists can implement feeding therapy, speech therapists like myself, as well as dietitians. Feeding therapy can take place weekly, bi-monthly, or on a monthly basis. And this obviously depends on the child's severity, their location, so how far it is for them to come in for therapy or for the therapist to go out, and financials. Feeding therapy can take place in a group or an individual setting. So in South Africa, we generally do individual feeding therapy just because we don't have the facilities to handle group therapy sessions. It can take place in a variety of environments. So, for example, the child's home, their school, or at the therapist's consultation rooms. And very, very, very importantly, is that feeding therapy needs to be individualized. So, no two children are the same. And so, their clinical feeding picture is also not going to be the same. And so, we need to take into account their feeding goals and their skills and create an individualized approach to feeding therapy. So I like to use this little visual over here. And what it is it's a feeding iceberg, and above the water, we see what would be the feeding difficulty. So all the behaviors we've seen that the child is doing, the aversions, if there's tantrums at the table, this is what we are seeing happening with the child. However, if we go under the surface, underlying, there's a whole bunch of other factors to take into consideration that are either contributing to or causing these feeding difficulties. And these factors are all the muscles, all the organs, the child's learning style, their sensory system, their nutritional status, their general development, so other developmental milestones, and their environments. So very importantly with feeding therapy is that it needs to be done in a team-based approach. So because it is so multifaceted, we cannot target or implement feeding therapy if we're not in a team. So for example, some team members, obviously most important is the parents and caregivers. Then it could be the child's pediatrician, an allergist if the child has any specific food allergies, a gastroenterologist if the child has any gastrointestinal difficulties, a surgeon, a pediatric dietitian, very important for nutritional input, a physiotherapist, they help us with general body strengthening as well as positioning, A speech therapist, we focus mostly on oral motor skills, an occupational therapist whose focus is on sensory, a play therapist, a child psychologist, or a teacher if the child is going to school. So now, in some instances, a child might have one or two of these team members as part of their team, while some more medically complex kids have almost all these members as part of their team. So I'm going to speak a little bit about the sequential oral sensory approach to feeding, so the SOS approach. This was developed over 30 years ago by Dr. Kay Toomey with input from Dr. Aaron Ross. It's an evidence-based approach, and it's quite nice in that any healthcare professional can be trained to be an SOS feeding therapist. I like to use this approach in my sessions, and I use it alongside other approaches that I feel is fit for that individual child. But this one I use in most, if not all, of my feeding therapy sessions. So the SOS approach to feeding integrates motor, oral, behavioral, medical, sensory, and nutritional factors in order to comprehensively evaluate and manage children with feeding or growth concerns. The SOS feeding approach is based on typical developmental feeding steps, stages, and skills found in children. So just as an example, the SOS approach looks at 6 major steps to eating. And eating does not begin in the mouth. So we start by looking at the food. This might even include being in the same room as the food. Then perhaps we can interact with it without touching the food. So using a utensil such as a fork or a toothpick. Then the body needs to process the smell of this food. The play then extends to touching with your fingers, hands, body, and mouth. And then tasting comes next. This could just be a quick lick of the food, or it could be the child putting the whole food in the mouth but spitting it out. And then finally, the last step is to actually practice chewing and swallowing. So I like to give parents some general treatment strategies, which I've included some for you here today. And these are things that, regardless of a child's severity, regardless if there's a diagnosis or not, these are things that can be implemented at home by the family, and that can make a big difference in the child's feeding journey. So, for example, number one, family style meals. This is basically like a buffet style where you all sit together at the table as a family and have all the foods out in the middle of the table so everybody can dish up what they'd like. What's very important about this is that you want to make sure that there's at least one preferred food for your child available. You don't want it to be super overwhelming for them and completely throw them off. Have some foods and at least one that is their go-to preferred food. Model good food behavior. Talk about the properties of food. What is its color? How does it look? How does it smell? How does it taste? And how does it feel? Encourage your child to stay at the table until everyone is finished. And I know this is a difficult one because often the kiddies want to get up and run around. But it doesn't matter if they want to move their plate away from them or have it completely removed from the table. We still want to encourage the child to stay seated at the table because meal times are social events. So we want everybody to be finished before we all leave. Implementing a mealtime routine. So many kids thrive on routine. So for example, a nice mealtime routine that we sometimes implement is marching to the basin, washing hands, sitting down for a meal. Once the meal's done, marching back to the basin, clearing off any leftover food into the bin, and then washing hands, and that will signal the end of the meal. Encourage your child to be involved in mealtime preparation. This is so important. It just allows the child to be exposed to different types of food. And it's amazing how if you include the child in the process, they have this buy-in and almost sense of pride that they've made this food for their family. Now, it doesn't mean that they're going to necessarily gobble it all up, but it definitely helps when targeting a feeding difficulty or a picky eater. Verbal praise for all at the table. This is important because we don't want the child to feel singled out. So we want to praise mom, praise dad, brother or sister for good food behavior so that the child feels that it's a family thing that's happening and not just singling them out. Importantly, present foods at your child's skill level and not age. So we want to set them up to win. So there's a big difference between therapy meals and family style meals. Family style meals is what's going to happen at home together with the family, and you want your child to be successful and not to be challenged or scared or intimidated by foods that they don't know or that they're scared of. Therapeutic meals happen in the therapy room with the feeding therapist, and these are the ones that challenge the child, that might be a bit scary for them, but we're trying to progress them in the up the steps to eating, and that's where we are targeting those things. At home, we want to set your child up to win. So, does my child need feeding therapy? I've included some instances or some red flags that if you notice your child is doing, it might be a sign that they need a feeding assessment and possibly feeding therapy. So eliminating complete food groups, this being protein, starch, fruit or veg. Eliminating 20 or less foods, especially if your child is dropping foods and not adding new ones. So their repertoire of preferred foods is getting less and less over time. Distress or avoidance at mealtimes, excessive coughing, gagging, or vomiting at mealtimes, difficulty chewing and swallowing foods, unable to transition to different textures, overly stressful for parents or caregivers and the child, poor weight gain for age, tiny sips or bites of food, which results in prolonged meal times. And if the child is tube fed, so nasogastric tube, orogastric tube, or a feeding gastrostomy, which is often referred to as a PEG. Thank you.